is extremely important, the adult vaccination, because the life expectancy is growing in Europe, in all the countries, in Italy in particular, because there are new vaccines available that are able to reduce the risk, sometimes also mortality risk, for example, for influenza, for pneumonia. And we have to change the cultural approach to the vaccines. Until some decades ago, the vaccine was considered only a preventive tool for children. Now we have to shift, considering the vaccination something that is good for each age. In fact, in this immunization schedule that the 4 scientific societies, including public health experts, epidemiologists, pediatricians, and general practitioners, they think that at each age we need a specific offer, cost-effective. I would say that for adults and for the elderly, the general practitioner may play an important role. For children and for adolescents, probably, we have to use other channels, new media, internet, that is more able to, for the penetration of messages in these categories. I would say that the strategy has to consider different tools in order to reach all the people, to give good information, scientific evidence, and to convince them that vaccine is an investment most of the time for each individual health.
The success of new media is people are at the center of communication. If we think about blogs and forums, people have an active role, whether it is a comment or sharing a video photo, but they feel they are part of the communication and they're not listening to something. And I think this is crucial. This is what, I mean, the definition of new media. And this is what we should use, and by we I mean public health practitioner that aims at communicating certain messages with regard to the benefits of vaccinations in general.
And what?
Both targeting the general population and healthcare practitioners is important to communicate what is true. We should start from science, but see how to make it appealing to the target population we are trying to reach.
Our scientific society, the Italian Society of Hygiene, Preventive Medicine, Public Health, considering the hesitancy for vaccination, they decide to organize a website in order to give proper information to the general public, but also to the physicians. And in fact, by looking at the time of the day and the period of the year, we notice that there are many physicians, probably public health officers, involved in some way in the vaccination program activities. They use a website also because there are some traditional sections, such as the list of vaccines available, the side effects, and some other sections, for example, comments to newspaper articles and TV program where maybe there is some controversy about some side effects or about the efficacy of the vaccine.